Your body is always talking, but are you listening? What if your watch could tell you when you are about to burn out, or when your heart rate rises before anxiety hits? What if your ring could detect poor sleep, stress, even infection days before symptoms show? This isn't science fiction. This is the wearable health revolution, and it is transforming the way we understand our bodies and our minds. Today, we will explore the science, the impact, the risk, and live life use of wearable devices in advancing mental and physical health. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at the impact of wearables and how they are transforming mental and physical health. This is the real science, and this is what is happening. And we look at real stories of where people have been able to change their lifestyle and they have their mental health taken care of before diseases are set in. So, what are health wearables? These are devices worn on the body, and they continuously track your health data. It could be a watch, it could be a ring, it could be a piece of cloth, it could be just a wristband. And they monitor the heart rate, they monitor your sleep, they even monitor your movement, they even monitor your stress, and can also monitor your body temperature. Some of these include things like the Apple Watch, the Oura Ring, the Fitbit, Garmin, and even Bearbeat. So they are used by athletes, patients, and also mental health professionals. From your steps to your stress levels, wearables turn invisible signs into real-time insights. So that wearable that you're having, that smartwatch that you have, it could be what will revolutionize your healthcare. So what is the physical revolution in healthcare from wearables? Improved heart health. A Massachusetts General Hospital study showed that people who logged more than 300 minutes of activity weekly using wearables had an 18% lower risk of atrial fibrillation and stroke. What this means that people are able to monitor their heart rate and their steps using their watches and the wearables. Then there is the issue of disease prevention and longevity. Fitness trackers help identify irregular heart rhythms, sleep apnea, and even infections before they set in. And this can give you warning signs. For example, before an infection sets in to a full-blown bacterial infection, you can have a rise in your heart rate, or an increase in your body temperature, or an increase in your breathing speed. And this can be monitored real-time using wearables. And then you can take the necessary precaution or do the necessary test to detect an illness before it sets in, and then you get treatment. The Oura Ring, for example, that is where uses temperature and heart rate to detect illness before symptoms show, and this has been shown to work. Then using the wearables to improve your habits. I know the 10,000 steps, people are using it a lot, and this is helping people to keep active, to monitor their steps, and exercise more. One step in improving your healthcare is creating awareness. The moment that you know that you are taking less than the recommended number of steps, then this tips your mind that you should walk more. What is monitored is able to be changed. So this helps to improve daily steps, and it has shown that people who monitor their steps are able to improve their steps by up to 1,300 steps per day. And so this means better health. They can even now work on their pace as they monitor this. And this has also been shown to improve exercise by 60 minutes per week by those people who monitor. Then hydration, posture, and standing time reminders. When you have a reminder, for example, you have a wearable, you have put it in a way. For example, there is an app in my phone that reminds me to take water the first thing I wake up in the morning. And if I've not done it, it gives me a beep and I go take the water. So this helps me to keep me more hydrated, and it can also remind you when you have sat for too long, and it tells you it is time to take a walk. And this helps you to improve your health and your movement. Then health literacy and goal tracking. If you set that I want to be walking this number of steps on a daily basis, then your wearable helps you to track, or the app helps you to track, have you achieved this? And it is helping you when you have done very well, when you have done poorly, and it gives you signals. So what gets measured gets improved, and now it is in your hands. So let's look at wearables and mental health. So devices use heart rate variability and skin temperature to detect stress spikes. So this can help you to incorporate activities that can improve your stress levels. Smart watches can also alert you when your breath, your meditation, or reflect light when your body needs it most. If you are getting burnout, then your smartwatch can alert you and you do meditation or do breathing exercises. Then digital interventions. Mindfulness nudges can help work out during stressful moment, or even you are emotionally overwhelmed. Then clinical psychologists have used wearables to time therapy training, and also do personalized mental health plans. This is helping people to be able to live better and be able to get timely mental health interventions. Then sleep and recovery. Poor sleep is equivalent to poor mood and also poor resilience. Using wearables, you can measure your rapid eye movement, sleep, deep and light sleep cycles. Then also give you recovery scores, and they also monitor your sleep date and also the circadian rhythm misalignment. When you have your smartwatches, they can be able to tell you how many hours of sleep you have had in a week, or how many hours of sleep you have had in a day, and what is your total sleep in 24 hours. And this can help you align with your body rhythms, and you can be able to track them, and they also help you to improve. So what are some of the limitations of wearables and some of the ethical concerns? Data anxiety. Constant monitoring can increase health obsession and also create anxiety. Then privacy risk. Sensitive biometric data needs strong security storage. Then over-interpretation. Sometimes when you monitor, like your heart rate is changing in different times. I've seen patients who monitor their blood pressure regularly and consistently get overwhelmed when they just get one reading that is overly or just slightly above the normal. They get very scared and they worried. Then this, remember, is wearables are a support. They are not a replacement to your health professionals for diagnosis and treatment. They just provide the data. You need to keep in touch with your health provider so that they can be able to help interpret the data. So use them wisely and do not get obsessed. So what is the future of this wearable science? AI and wearables are hyper-personalized tools that can help you to improve your health, and also they can give you tips on what to do to improve your health. The integration with healthcare leads to shared data, and this will help you to take care of you better. Then these are holistic dashboard. They can guide your nutrition, your hydration, your mental health, and also your movement, all in one place to improve your health. Then this can give you predictive alerts, identifying health issues before you feel them. And this will help you to get more empowered and take more interventions that will help you to live better. So the goal is we move from reactive to more of a preventative medicine, real-time health empowerment using the wearables so that you can be able to take care of yourself in a better way. So remember that wearables are helping us to listen to our bodies in ways that never have happened before. So they empower us to catch disease earlier, they improve our behaviors, and they support mental clarity and resilience. They help us to sleep deeper and also stress less and move more. So your body is giving you clues every moment. Wearables help you to finally hear them from what your body is telling you. So comment below, what is your one thing wearable taught you about your health? For me, I think wearables have helped me monitor my sleeps. So subscribe to the overall health for more science-backed health truths to keep you more healthy. Share this with a friend who is into fitness and needs to improve their sleep and also their mental wellness using wearables. Then remember that we are continuing with this information and also enlightenment. So do not forget to click on the bell so that when we release any new content, you can be informed and take charge of your health in a better way. Share this also and also comment on what we need to be doing to improve our health in better ways. Thank you for watching. We meet in the next video.